This presentation is on Medicare hospitalization and what seniors need to know when they go to the hospital under Medicare. My name is Benjamin Pierce. It's all about hospital readmissions. The Hospital Readmissions Reduction Program, mandated by the Affordable Care Act, cuts reimbursement rates for facilities with readmission rates that are above the national average. Hospitals are penalized for readmissions within 30 days back into their institution. Current heart failure, heart attack, and pneumonia are focused, and added will be hip and knee replacements and COPD for the year 2015. Medicare has credited the penalty program for combating a perverse financial incentive. Hospitals earn more money if their patients' health deteriorates after they are discharged because they can be paid for 2 stays instead of 1. Penalties for each readmission above the average range from $33,000 for each patient readmission after COPD treatment to $285,000 for each readmission after hip or knee replacement. A hospital isn't just penalized for those readmissions that exceed a predetermined percentage. The hospital's entire Medicare reimbursement for that year is reduced by increasing percentages. Outpatient status. Prior to the change above, there are times when a hospital may not be able to admit someone to the hospital on an inpatient status because there isn't sufficient medical necessity. But it may not be safe to send someone home either. Instead, the hospital will keep that person in the hospital and code them as if being under observation, historically for 48 hours or 2 days and 2 midnights with an outpatient status. Outpatient status extended. To avoid these penalties, hospitals are putting many people on observation, which is outpatient status, for long periods of time, and patients are not being coded with inpatient status. This distances the hospital from the 30-day readmit financial penalty, as they never coded the patient to inpatient status. It shifts the risk and the financial burden to the Medicare patient instead. The patient could bear the financial burden. Patients who have spent beyond 2 days, 2 midnights in a hospital and who were never coded with inpatient status will have their insurance claim to Medicare processed as outpatient, not inpatient, and the benefit paid for the hospital is much less, putting the Medicare recipient at financial risk. And if the patient goes for rehab after this hospital stay, under Medicare A, room and board won't be covered because they went there with never having been admitted to the hospital as an inpatient, where there must be a 3-day minimum stay, which is a 3 midnight rule. They still, however, may be able to receive Part B therapy services. Not admitted, no coverage. Some insurances, including Medicare, don't consider observation status as an admission, and therefore they don't cover the costs that they would if the patient was hospitalized. That means the patient can be charged cash for their visit. The cash payment for an outpatient visit is far higher than any reimbursement from the insurance for an admitted patient stay because the insurance companies negotiate far lower rates for the patients that they cover. Medicare patients who must be admitted to a nursing home are required to be fully hospitalized prior to the nursing home admission if they expect Medicare to pay for their nursing home stay. If a patient had been put on observation status instead of fully admitted, then there will be no Part A nursing home reimbursement. That can amount to thousands of dollars or more and quickly deplete someone's financial resources. If Medicare is to cover any nursing home costs, the patient must formally be admitted to the hospital for at least 3 midnights. How does this impact on senior living? Well, outpatients on observation should be advised that they may not qualify for Medicare reimbursement for their placement in a nursing home or rehab center, even after an extended period of hospitalization as an outpatient. Senior living residents who are medically stable can come back to their community and get their doctor to write a script for in-home therapy, which is covered. Medicare Part B, 80%, and supplemental private, generally 20%, right in their own senior living community. Home health therapy is normally limited to 4 weeks at 2 to 3 times a week. For extensive needs, Medicare B services 5 times a week for 6 months. It's far less expensive to bring in home health care or nursing to meet medical needs. Research has shown that response to therapy is more successful in a familiar home environment, plus they're already paying there anyway. Residents with shortness of breath, chest pain, pneumonia should be discharged back to the community if possible instead of a nursing home or assisted living or rehab center. What families should know. Families need to inquire as to their loved one's status, inpatient or outpatient, when they go to the hospital, as they may be much better served to return to the community to access home health or rehab at a fraction of the cost of nursing home, which they may need to pay for privately if they were admitted under observation. Families should check daily and see in writing that they are actually admitted to the hospital and that they have inpatient status. Patients who are discharged as outpatients will be responsible for their hospital bills personally, most of which are charged at the highest ER rate. Medicare and nursing homes. Nursing homes are looking to admit people, generally after a 3-day qualifying hospital stay, and hold them as Medicare patient for 20 days until the coinsurance requirement kicks in. This is why they won't release them back to their senior living community until the 20 days are used up. They're not ready for discharge? Well, they're less than 20 days. Families do not have to accept this. There is no limit to the number of benefit periods you can have. However, once a benefit period ends, you must have another 3-day qualifying hospital stay and meet the Medicare requirements before you can get up to another 100 days of skilled nursing facility benefits. But if you are not an inpatient at the hospital, the stay will not reset the benefit period and the patient will be forced to pay privately. Some families may wish to consider day and respite therapy. Many patients are sent home after 2-day knee or hip surgery, often with an underlying condition. Home health alone may not be able to provide the needed therapy. One of the family members could drop mom off at the senior living community on the way to work for rehab therapy under Part B and then pick her up on the way home. Senior living communities with a strong ortho program could provide short stay for access to therapy services and have better outcomes. Such a program could be a feeder for permanent residents. This has been Medicare Hospitalization, What Seniors Need to Know. I'm Benjamin Pierce. For more information, visit my website at planetbenja.com.